Nice to meet. This is Cutting to the Case with Cameron Sabet, and I'm with Dr. Amendola. This is the president of the American Academy of Orthopaedic Surgeons. So just to start out, let's start with your leadership story. So what experiences from your early training to now leading the AAOS most shaped your views on orthopedic leadership and service?
Well, I was fortunate to have a lot of mentors along the way. I think we all kind of follow on the shoulders of many people that affected our career, and so where I trained and where I worked, you always run into people that really have a significant influence. I trained in Canada. I did some 2 years of fellowship training in America. Then immigrated after 10 years in practice in Canada, immigrated to University of Iowa. And Iowa has had a long history of orthopedic leadership, and several of my mentors at Iowa were presidents of the academy, presidents of many organizations, and so you get involved with these people that really are icons in the profession of orthopedic surgery. And so as a result, you follow in their footsteps, you volunteer, you get involved in committees, you get involved in teaching, you get involved in research, and you basically love the profession of orthopedic surgery. So whatever you can do to continue to make the profession better, this is what we do. So you just keep getting more and more involved, and eventually people ask you to do stuff, and you get to this point of being the president of the academy.
That's incredible, and the academy is a very diverse entity. It's at the crossroads of policy and practice and innovation. So what do you see as the most urgent challenges and the biggest opportunities facing orthopedic surgeons today?
Well, I think the biggest challenge and also the biggest opportunity is that the change and evolution that's occurring in orthopedic surgery, education, orthopedic practice. So if you look at everything that's going on, when I started, it was relatively simple. You're either in private practice or you're in academic practice. Now it's a combination of many things. It's a combination of private practice and academic practice, hospital-based practice. You have large group practices. You have a lot of equity practices that have come into play. And so the practice of orthopedic surgery has changed, and we're dealing with many more forces in the field. So in addition, orthopedics has always been a booming technology, laden specialty. There's always innovative research on how to cure, joint problems, joint arthritis, deformity, tumors. And so when you combine that all together, it's a period of great evolution and great change, which creates a lot of anxiety amongst orthopedic surgeons. At the same time, I think it's a great time for opportunity to get, a larger group of the membership involved, get younger members involved. I think we certainly have had a huge increase in the number of students, residents, fellows, and candidate members being involved in the academy. The diversity part and kind of spreading across all the various different types of people that come into the specialty of orthopedics has increased greatly over the last few years. So I think with the change and the evolution of orthopedic practice, I think it's really brought in a greater infusion of younger members that are really interested in modernizing our profession.
Yeah, absolutely. And I want to be respectful of your time as well. I understand we have 5 minutes here. So really the crux of this podcast is that intergenerational, the younger, future surgeons as well, being kind of the liaison of high-powered orthopedic leaders like you and the up-and-coming generation. So for trainees and medical students listening, what advice would you give those just starting their journey in orthopedics today? And what should they prioritize and what should they tune out?
Well, I think most importantly, I think they should just have an element of curiosity and open mind. I think there's so much to learn and so many things to take in. As far as the academy is concerned, it's a great opportunity to be involved. There's many opportunities for students to get involved with the academy. You can, we have a fall meeting in Washington. You can come and you can see how our Office of Government Relations and how we communicate with, our government representatives, that we have. So there's a lot of opportunities for students to get involved at their local level, but then in addition, we have a great student body It's involved at the academy and committees, and really kind of pushing the specialty of orthopedic surgery. So I think it's a great opportunity for students if they want to get involved and get interested in the field of orthopedic surgery to get involved with the academy.
Absolutely. And thank you so much for your time. I really appreciate you taking the time out of your busy day for this.
Well, thank you, Cameron.
Absolutely.
I hope this is useful.
And thank you to Dr. Eward, who's the cameraman here. Really appreciate it. And this is Cutting to the Case. Cameron Sabet signing off.